Phase 2 is going to start any day. We got the green light from the FDA. Phase 3 will start in July. It is possible, assuming a best case scenario, and there are many risks that could derail us, obviously, but we could potentially be in a position to file to the FDA toward the end of the year or early next year. Again, it's best case scenario.
All right, just a thought that maybe this might not happen so quickly. Hit Moderna stock yesterday. It's since rebounded today on the hope again that a vaccine could be ready by the end of the year, certainly early next year. That's always been out there. Dr. Jen Caudle joins us right now, family physician, Rowan University associate professor. Doctor, always good to have you. How much are you betting on this? I know there are a lot of different possibilities out there, treatments, vaccines. This tends to get the most attention. What do you think?
Right. Well, Neil, I'm hopeful, and I think that it's reasonable for us all to be hopeful, but we have to sort of weigh that hope with, the realities, right? The trials are not done. Yes, it seems that there was some promising data that we've just received about this particular vaccine candidate. But honestly, I read the press release. I don't have all the data was not presented here, so you can't really look at it with a fine-tooth comb. There still are more trials to go through with this particular vaccine candidate. Other things, Neil, I have to mention is we have to keep in perspective that we've really never had a vaccine produced this fast. We know it takes years and years typically to make vaccines. It's not to say that we can't do it here, but we have to just sort of remember the overall context. However, look, there's a lot of resources being poured into a vaccine right now, and we are working very hard to get a number of vaccine candidates that are potentially viable, so that we have options and can sort of ramp up production that would be needed. So I know that I'm sort of talking on both sides of my mouth right now. I'm saying the pros and the cons. Overall, I am optimistic. I am hopeful, but we, as always, have to wait and see.
No, you're being very cautious, and you want to see data. There's a concept. But let me ask you, Doctor, about the reopening that's going on, all 50 states right now. And in fact, it's very aggressive. In fact, I believe by the end of the week in Alaska, it will be fully open. I mean, fully.
Yeah.
The pacing of this and everything else, what do you think of how it's all going and sorting out?
Yeah. So, you and I have talked about this week over week. And I don't know, a few weeks ago, I told you, how are we talking about reopening? Well, we got cases that are still soaring, and I talked about sort of the cognitive dissonance that created within myself. Look, every week is different. Every week is new. That is a good thing with coronavirus. It means we learn more. And look, we still have a ways to go in this pandemic. We are still in a pandemic. States have a long ways to go, and not every community is dropping in cases. Some have sort of stalled. Some are going down, but some are not, and they're going up. The thing is, we are reopening, honestly, whether I think we should or not. So what I'm telling, my patients, what I'm telling my followers, what I'm saying to you, Neil, and to your audience is this. No matter what's happening where we live and in our community, we have to remember that social distancing is our best friend. And aside from that, following the guidelines of our local and state governments, because they're really determining what we're allowed to do. But on top of that, remembering that just because your area may be opening up doesn't mean you have to open up with it if you're not comfortable or if it's not the right thing to do. So we still do have some choice in this, and that's what I want people to sort of put, I want them to sort of utilize that choice and really make the right decisions for them and their family.
There are a lot of older workers in particular, doctor, who feel, I think we should get back to work, but I'm in that vulnerable group that could be affected if I rush back too soon, and I'm worried if my boss looks askance at me that I'm not eager to get back and all. They worry about that, and they fester on that. I've heard a good number of them who've emailed and texted me, called me, that sort of thing, and they always want to know the latest. And I don't know what to say outside of, just play to your comfort level. But the pacing of this is going to be that group will be among the last to return to work anyway. And maybe that's why they feel vulnerable.
Well, that may certainly be the case, but, they probably also feel vulnerable, perhaps because they might be from a medical standpoint, underlying medical conditions. Right. As a family doctor, I've still been seeing patients all throughout this pandemic, but doing telemedicine sort of, on the computer and on the smartphone and things like that. And I've had a number of patients say that they were afraid to go to work because of their underlying, rheumatological condition, or they have a weakened immune system, or they're a cancer patient, or things like that. It is a tough boat to navigate. And let's be very clear, in addition to that pressure, we know that people need to live. No one is out here saying that we can do without jobs, because that's not the case. It is for very few, but most of us need to work. So then you have that compounding, people need their jobs. They're afraid of losing them if they don't show up to work. I'm not in any way going to say that this is a simple scenario. But what I would say is that for anybody who may feel like they are in that boat, you've got certain medical conditions, you're having issues with work or whatever, involve your healthcare provider. I can't say that there's something we can do, but we might be able to help in some ways. And so I hope my other colleagues out there don't mind me saying this, but, look, this is a joint and a team effort. And especially if you were put at risk because of underlying medical conditions, it certainly behooves you to talk to us about what you're going through. If we can help, we will.
All right. And to your point, we're still registering, 1,500, 2,000 deaths a day in this country.
Right.
You balance that, with what you think is the right thing to do versus maybe something that could backfire on you. Doctor, thank you always. I always learn a lot. Dr. Jen Caudle, family physician. She calls it as she sees it, which is rare to see among doctors these days. You do, and I appreciate that.